Hello everyone, my name is Dr. Sienna Miller. I'm a naturopathic physician based in Washington State and I specialize in dermatology. The purpose of this video today is to just talk about my approach to acne as a naturopathic physician and how it kind of might differ from more of a conventional approach that you might get with a dermatologist or like a primary care doctor. Just a little bit on my background. After undergrad, I worked as a medical scribe in a very busy conventional dermatology clinic, and so I've seen hundreds and hundreds of acne cases approached through a conventional lens, using pharmaceuticals including topicals and oral medications. So I'm very familiar with what that approach looks like and what the sort of standards of care are for acne. And I don't discredit any of that. I use some of those things in my practice when they're needed. But I just want to talk today about how my approach differs a little bit. I'm really dedicated to determining and treating the root cause of acne. And I'm going to go through kind of the main categories that I look into there. This video is going to be very brief and kind of a broad overview, and I will make more specific videos in the future. So when I first get a new acne patient coming into my visit, we're doing a long detailed history, when things started, different triggers, patterns, different things that they've tried for treatment, whether it be like pharmaceuticals, supplements, other lifestyle interventions. And then I'm asking with all my patients determinants of health, we call them. So I'm going through a full diet history, hydration, movement, sleep, stress, all of those sorts of things. I'm getting a really good history. So part of the treatment plan at my first visit and different, labs that I order, it's pretty broad. So I'm usually doing a lot of similar labs for most patients, and they can vary based on kind of what I'm picking up in their history. So the main categories, I would say, as far as root causes of acne goes, we talk about skin hygiene a little bit, so a patient's skincare routine, but honestly, acne is not usually a topical issue. It's usually something going on internally. But, we make sure we talk about skincare, and I recommend some good products just to make sure there's nothing there that's contributing to the acne. Next is going through diet. There's several different foods that are known acne triggers, like they promote the acne pathways on a biochemical level. And so we're talking about those foods that includes dairy, sugar, gluten, meat in high quantities. Those are the main four. And we're also talking about nutrition and foods that can help with acne, help support, healthy hormone balance, gut health. So things like a really high fiber diet, lots of colorful fruits and vegetables, antioxidants, things like that. So after we've talked about nutrition and making sure we're addressing anything glaring in their determinants of health, foundations of health that need to be worked on, so stress management, making sure they're getting adequate sleep, movement, sweating, hydration, all of those things to really support kind of those foundations of health, which I'm doing with any patient anyway. Next, kind of getting into more of the deeper root causes. Honestly, beyond like diet and food triggers, there's pretty much, 2 to 3 other categories that I find to be the biggest causes for most people. I would say number one is addressing gut health. So I'm always doing some sort of gut testing with most of my patients. Some of it can be done through the blood work, just depending on what symptoms I'm picking up, what needs to be tested for. And then for most people, I'm usually doing a comprehensive stool analysis or like a SIBO test, whatever seems to be indicated, and we're treating based on the results of those tests. For example, overcolonization of bacteria in the gut, dysbiosis, leaky gut, intestinal fungal overgrowth, candida. These are all common underlying causes of acne that I'm testing for and addressing. The next umbrella, kind of go hand in hand, is hormonal imbalances and kind of metabolic dysfunction. So by metabolic dysfunction, mostly like insulin resistance, kind of blood sugar dysregulation, things like that. So I'm often checking like a metabolic panel, hemoglobin A1C, insulin, liver enzymes, make sure the liver is healthy. And then other hormonal imbalances, I would say kind of the biggest ones are like an androgen excess issue, like elevated testosterone, DHT, PCOS type picture. We can also get imbalances of estrogen and progesterone that are contributing. So if a patient's telling me like their menstrual cycle is very irregular or they're having really severe symptoms, that tells me, okay, maybe we need to dive into hormones right away. And then also checking thyroid as well. And sometimes cortisol and DHEA, so getting a good look at the adrenal hormones as well. So that's kind of the whole metabolic hormonal picture, and usually part of the labs that I do. And then kind of lastly, just making sure they're detoxing well, so making sure they're having regular bowel movements every day, that they're urinating to have like a light straw colored yellow urine, and making sure they're getting enough hydration there. And then I want to make sure people are sweating as frequently as possible. Yeah, and this kind of varies case to case. Whatever symptoms seem to be more dominant, like if they're having raging digestive symptoms, I'll usually start there. If it seems to be more of a hormonal picture, I'll usually start there. But through all of these avenues, I find great success in treating and like leading to like long-term resolution of acne versus just sort of being on medications to manage, because I find a lot of times the pharmaceuticals work really well, but the minute somebody goes off of those things, acne will come back. So these are the main ways I address acne in my practice every day. If you like this video, give it a thumbs up. Let me know if you have any questions down below. I can make future videos if people want to hear more about a specific topic. But yeah, I hope you have a great rest of your day, and thank you for watching.